kind words, Dr. Raphael. So yes, just as a little background, I am a cardiac trained anesthesiologist in pediatric anesthesia and adult cardiac. But I really began my career in biomedical medicine, and then transitioned to general surgery before finding my niche in anesthesia. The reason I founded my company was to address the third leading cause of death in the United States, which is medical errors in the hospital. So with that introduction, let me just share my screen so we can get, one moment, share my screen here so we can start. And all right, hopefully everyone can see my screen. And so, yes, I am the co-founder and CEO of OSSI. We are a connected health company connecting care providers to their patients in real time. And really, the future of digital health is to enable health and care at a more affordable cost and make it more accessible. My topic today is Conquering the Digital Divide, a novel proposal to heal a fractured healthcare system. So in doing my research, I'm not an expert in Nigeria, but doing my research on Nigeria, and I'm going to use a little digital, let me go back here in a moment. I'm going to use a little digital pointer. If you're born in Nigeria today, your life expectancy is just under 63 years. If you look at the global average, Nigeria is near the bottom. And if you happen to be in Japan or certain countries in Europe or Asia, your life expectancy today is 82 to 84 years. The average globally is 73. And Nigeria's had a tremendous improvement in its healthcare, in the life expectancy, and it's now plateauing. But how can we keep this curve going up and try and get closer to the global average? So what is it that makes Nigeria unique? All right. And most people here probably know this, but just to review, there's over 220 million people in Nigeria. Over 50% live in poverty. I was surprised to learn that almost 50% of the population earn less than $2 a day. There's limited access to care, and that's responsible for almost 25% of the deaths in Nigeria. It's one of the most culturally diverse countries on the planet. Although there are only several main languages, over 500 are spoken. There's low literacy rates, and because of all this, a lot of people in rural areas resort to native medicine. Less than 5% of the population has health insurance coverage, and there's a fragmented healthcare system of the federal government, state, and local, with the focus of local governments on primary healthcare clinics. And of course, there is the private sector. There is geographic inequality or spatial variation between regions, and then there is the brain drain. I work actually in a hospital with Nigerian doctors who've retrained and are practicing here in the US. So there's an emigration of healthcare workers. With my understanding, one doctor for every 10,000 people. So the question is, what is the solution? And what I believe needs to be done to move in the right direction in Nigeria is apply concepts and technologies that have been proven elsewhere to work and apply them to the unique situation in Nigeria. So what I'm going to focus on today is virtual hospitals and reimagining primary care. So first of all, I've traveled all over the world to China, Saudi Arabia, Europe. I haven't been to Africa, but Saudi Arabia is really quite unique in the world, and I'm going to spend a little bit of time to speak about their virtual hospital. And explain how the concept of concentrating doctors and specialists in a virtual hospital can maximize their benefit to society. At the other end, I want to speak about a company called Elara Health as an example of how one can apply nonprofit and a for-profit company to improve access to care at the local level. And I'll speak a little bit more, but they equip a network of primary healthcare clinics with essential diagnostic tools to improve the quality of care. And then, of course, what I'm going to speak about is what my company does, which is digital infrastructure, how we can help local clinics have access remotely to consultants that are centrally located, and how the data can be stored in a central database for the future of AI. And as you see that this is a policy position, a proposal that the government should be responsible for providing a digital infrastructure and for providing a virtual healthcare system, and link this with the benefits of, we'll explain here in just a moment with the local hospitals. So let's begin with Saha Virtual Hospital. Its chief medical officer has stated its aim is to promote the culture of telemedicine and digital health to improve access to healthcare and enhance its qualities. It was launched in February of 2022. It is literally the largest virtual hospital in the world. I've visited there. It's located in Riyadh in the Ministry of Health. It supports more than 160 hospitals around the kingdom. And amazingly, they're able to support, and they have a capacity of managing 400,000 patients annually. They provide 15 main specialized healthcare services, emergency and critical care consultations, medical support services on virtual x-rays, pathology and pharmacy services, and a variety of consultation services, as well as home care services. So they have 3 sections. One is manned by doctors 24 hours a day, where people can call in and speak to a primary care doctor. They have another section for consultations, and a third area that looks a little bit like NASA with large screens, where they provide consultation to critical care hospitals throughout the kingdom. So this is one of the concepts. The next I want to focus on is Elara Health. So I was recently, maybe about 6 months ago, at a boutique meeting called NextMed Health, where I met Emilian Popa. He's the CEO and co-founder of Elara Health. And this is really quite interesting. They're reimagining primary care in Africa on a microscopic level, or microeconomy level. That is, what they're doing is they are providing, I'm going to show you here in the next slide, what they do is they provide microloans to these primary healthcare clinics that are essentially run mostly by women who are nurses, and there are no doctors. And because people can't afford healthcare, they really are limited in what supplies and equipment they have. So they give them a loan of a few $1,000s and provide them with a variety of equipment that you see here on the screen, including in the middle is a butterfly ultrasound for, like, say, prenatal care. And they then give them support through providing them a digital health record for patient engagement so they can record everything. They give them the infrastructure for billing so they can monitor them and help them with consultation services. But more importantly, they actually provide a little bit of competition here. They let them know when they give them these microloans that they're competing with local clinics in the area. And they actually monitor how well they're doing in their performance. And those clinics that do more, they lend them more money and give them more equipment until they're big enough to need and require a physician. And they have successfully implemented this in over 2,500 clinics throughout Kenya through grants from both the French government and the Bill and Melinda Gates Foundation and private investment. And it's a very creative way of making an impact in rural areas where people have less access. They also provide them with dispensaries. So I'm not sure of the laws in Nigeria, but in Kenya, they're allowed to dispense medication, and they actually give them software to manage and maintain their inventory control. So it's something that's very novel and making a huge difference. And so what they're doing is they're creating a model of value-based patient-centered care for Africa, and they're trying to bring this to other areas. I found this quite fascinating because they're providing them with low-cost diagnostic equipment, test equipment, where they can really make a difference. And what they're doing is empowering these small clinics to turn into a successful business as well. They're giving them the tools to generate revenue to which they can expand their care and actually elevate their own standard of living. What I would like you to do if, oh, I see. Well, I would like you, if you could, take out your camera. I had a separate camera here that's not showing up, pointing at a patient monitor. And so I may, for a moment, point my camera over here. Well, there'll be a little bit of a delay, but you're going to see that I have a Philips portable transport monitor, and it's connected to a box like I'm holding in my hand, which is our Internet of Things box. And if you simply take out your camera, point it at the QR code, you'll get a little pop-up window. And if the demo's working in a moment, you're going to see the vital signs from that screen beaming to your phone. And give it about 30 seconds. I'm going to continue. I'm going to take a Bluetooth device, and it's going to take about 30 seconds. That's in demo mode, and happen to be pacing spikes on there. That's why the QRS is large. But in a moment, if this works properly, my Bluetooth signal is going to be synchronized to that, and it's going to show up, and there it comes. And basically what I'm showing you is a low-cost solution where basically a phone and this box together, and this is actually, and I'll talk a little more about it, our medical grade Internet of Things is 5G capable, cellular or satellite. And with what I'm holding in my hand, you can provide universal access to healthcare anywhere on the planet. So with that, I'm just going to continue here for a moment and basically say, so let me show here. We specialize in medical device interoperability. That's the focus of OSSI, as well as remote monitoring of critical care patients, team communication, and team collaboration. So we're able to, in a hospital, connect to all the variety of devices that you see, as well as home devices and wearables and video, integrate it, present it, and govern it, and provide that data centrally. So how does that actually look? Well, we work with all the medical devices you have, that you have in your hospital. We're vendor agnostic. We always have a growing library of device drivers. We're easily scalable and deployable anywhere using this technology. And if you're want to set up a virtual hospital, you can monitor endless numbers of patients through our virtual EICU. And you can connect to what we call PAC servers, where you store digital images. If you have an electronic medical record, we have a universal viewer that allows you to see all of the data in a unified structure. And you can remotely monitor critical care patients anywhere they are, making telemedicine simple. The beauty of this system is that you can, instead of telemedicine, think of it as telepresence. So through this system, you can have multi-party video calls with remote collaboration using IP phones or USB phones or even your smartphone. You're able to send a link via, say, WhatsApp to a family member or a translator, and you can have a conversation with the patient remotely anywhere they're at. You can review all of the data, streaming data, laboratory data, et cetera, where accessible. And most importantly, I think the future is medical grade wearables. Not everyone can afford the expensive medical devices by GE, Philips, even those made in China. But the future is going to be cheap, inexpensive wearables. So, for example, I have a device here that's relatively inexpensive, made by MoveSense, that monitors continuous EKG for up to 18 days. I have, this is a little more expensive, but this is one of the best medical grade. This one happens to be several hundred euros, but you can wear this on your wrist and it monitors blood pressure, heart rate, respirations, respiratory rate, core body temperature, oxygen saturation. This type of technology is the future, okay? And we bridge this technology to hospital healthcare systems, synchronizing all of the data to the millisecond. Now, what I want to spend a little bit of time on for my last few minutes here is medical data governance. And really, what is medical data governance? This is the glue that's going to connect the primary care hospitals, primary care clinics to a virtual hospital. Every system, every hospital, every clinic stores data in a different way. What medical data governance does is collect the data in a standard format in real time so that all of the data is time synchronized and structured for the future of AI. But more importantly, it combines the metadata that's in any medical record. So this can become the future of a portal for a patient to take their data from a clinic to a hospital and back to a clinic. More importantly, it standardizes all of the data for a virtual hospital. So, in summary here, what we're looking at, Nigeria needs to invest in a digital infrastructure to connect primary healthcare clinics and hospitals to a centralized consultants in a virtual hospital. When you have limited supply of doctors, the best way to utilize them is put them in a concentrated virtual hospital where you can magnify their effect on society. You need to reimagine primary care as an example like Alara is doing by giving microloans to clinics to give them the tools they need. And in the middle is medical data governance, something that needs to be funded by the government so the data throughout the country is in a standard format. And this way, I believe, through providing a digital infrastructure for the country, not only can you digitize and transform hospitals, but you can digitize and transform this fractured healthcare system at the local and rural level. So I thank you for your time, and if there's any time left.
Very much. Thank you very much, Dr. Harold Arkoff. We really, really appreciate you because, in fact, it's just as if you shouldn't just, conclude this presentation, because from your presentation, I was following you with keen interest. A lot of, very modern technology that we need now in healthcare system that is really going to make, the delivery of healthcare system much more easier and affordable. This is a very brilliant one, and I believe strongly that a lot of people are really listening to you and watching you, and definitely this is going to really make a lot of way in Nigeria. I'm telling you the truth. And most importantly, when these particular devices are really customized in the most indigenous way that is going to really speak the language of Nigerian society. This is a very brilliant one. I believe a lot of people will have a lot of questions to ask you as regards this, and to also have a contact with you. And I'm very sure once we get these people, I'm going to really, the organizer will really get across to you so that you can, further the collaboration between your company and, those people that may be interested in these very wonderful and fantastic, devices. Thank you very much, Dr. Aaron.
Well,
you have really made our beautiful day today. It's been so wonderful. Well, thank you, sir.
You're welcome. I was happy to kick off.
We still hope you're still going to be with us.
I will for another 30 minutes before I head off to the operating room.
Oh, great, great. I understand. I know you're very busy. Thank you very much. And while we continue with this presentation, we'll be